Thrombosis, or what we call تجلط الدم أو تخثر الدم, can be caused by primary abnormalities. The primary abnormalities that lead to intravascular thrombosis are called virtuous triad, and they include endothelial injury, abnormal blood flow, either as stasis or turbulent blood flow, and hypercoagulability of the blood. We will discuss these in a minute. Let's start with endothelial injury, the first component of virtuous triad. But before that, let's remind you with the endothelial cells. The endothelial cells are these cells that line the innermost layer of the vascular walls, and also they line the heart chambers, and in the heart they are called the endocardial cells. So these cells are in direct contact with the blood. So endothelial injury can be caused by several factors, including physical injury, infectious agents, abnormal blood flow, inflammatory mediators, metabolic abnormalities such as hypercholesterolemia or homocystinemia, toxins absorbed, for example, from cigarette smoke. Endothelial injury leads usually to endothelial activation or dysfunction that triggers thrombus formation. Let's discuss some clinical examples of endothelial injury. Endothelial injury or endocardial injury may follow myocardial infarction, and the thrombus will be formed in the cardiac chamber that is affected with myocardial infarction. بعد ما يصير عند المريض جلطة قلبية، الاندوثيليال cells الموجودين في نفس المكان رح يكونوا تأثروا وصار لهم injury, and this injury will result in thrombus formation. Also atherosclerotic plaques, تصلب الشرايين. تصلب الشرايين بيتكون على الأوعية دموية معينة زي الكوروناري artery أو السيريبرال artery، وبيكون في عنا atherosclerotic plaque رح نحكي عنها في الكارديوفاسكولار سيستم. This atherosclerotic plaque عندها fibrous cap وعندها central core. الcore is full with cholesterols. This atherosclerotic plaque, if ulcerated, it will be, the endothelial cells will be traumatized and injured and exposed to the blood flow, and this will result in a thrombus formation. Also, thrombus can happen at the site of a traumatic or inflammatory vascular injury, which we call vasculitis, when we have an inflammation within the vascular wall itself. This will result in endothelial injury, endothelial activation or dysfunction, and thrombus formation. Abnormal blood flow is another component of virtuous triad. But before discussing the abnormal blood flow, let's remind you with what is called normal blood flow. Normally, the blood flow is called laminar flow, as in this figure. And this is the normal condition for blood flow throughout most of the circulatory system. So what do we mean by laminar flow? Laminar flow, from the name laminar, which means layers, so laminar flow is characterized by concentric layers of the blood, like in here. These concentric layers of the blood move parallel down the length of the blood vessel. So the lowest velocity found along the vessel wall. إذن أبطأ الطبقات بتكون هي الأقرب للإندوثيليال cells وأسرعها الموجودة بالسنتر. نقطة تانية إنه السنتر فيه البليتلتس and other blood cells are found mainly in the center of the vessel lumen, and these cellular components are separated from the endothelium by a slower moving layer of plasma. إذن هون بالسنتر في عنا البليتلتس and other cells, and here we have the plasma. Okay, and then we have the wall or the endothelial cells. So disruption of the laminar flow lead to what we call turbulence. إذن اضطراب laminar flow بنسميه turbulence. Stasis, on the other hand, means a slowing or stoppage of the normal blood flow، يعني ركود الدم في مكان معين. إذن إبطاء حركة الدم is called stasis. Turbulent and static blood flow contributes to thrombosis in a number of clinical settings. Let's take some clinical examples. Ulcerated atherosclerotic plaque that we talked about when we discussed the causes of endothelial injury is also an example here. Because the ulcerated atherosclerotic plaque not only caused endothelial injury, but also it caused turbulence, and both will result in a thrombus formation. Another clinical example, abnormal aortic or arterial dilations, which we call aneurysms. رح نحكي عنها بمحاضرة cardiovascular system. Those create local stasis and results in a thrombosis. So in general, turbulence leads to arterial and cardiac thrombosis by endothelial injury, and stasis is considered the major factor in the development of venous thrombosis. Hypercoagulability is another component of virtuous triad and is considered as an important underlying risk factor for venous thrombosis. Hypercoagulability refers to an abnormally high tendency of the blood to clot، يعني الدم أسرع قدرة على التخثر. Causes of hypercoagulability can be divided into primary causes or genetic causes and secondary or acquired causes. The primary or genetic or inherited causes of hypercoagulability appear mostly in young patients، يعني غالبا المريض بيكون أقل من 50 سنة. إذا صار في عنا presentation of hypercoagulability لمريض أقل من 50 سنة بدنا نتوقع بالأول إنه هذا primary or genetic or inherited hypercoagulability.